Okay, everyone, welcome to this webinar on mindfulness-based pain relief. My name is Dr. Joe Tatta. I'm a physical therapist, and it's great to have this time and this space and this technology to join all of you from both near and far. I'm going to probably talk for about 30 minutes or so about some of the science and the practical implications of mindfulness and how you can use that in your physical therapy or whatever practice it is that you have. This webinar is open to everyone. I welcome everyone to join in our community and attend the webinars. No matter who you are and where you're from, this webinar is primarily for healthcare providers. But if you're someone interested in learning about mindfulness, I guarantee you'll take something positive away from this as well. So this is a webinar on mindfulness. I'm going to talk about some of the science and the research behind mindfulness, why it's important for physical therapists and in pain care, and we'll talk about some of the practical applications as well. Mindfulness is a very experiential practice, meaning we can talk about the research behind mindfulness as for a long time. There's lots of research out there that supports it. But as an experiential practice, it's good that if we experience what mindfulness is like in our own mind and body, so to speak. So to get started, I would like to invite all of you to do a really brief, less than 5 minute mindfulness practice that I often use with patients and clients. This is kind of a more beginner practice. So beginner practices tend to be shorter. They tend to be a little bit slower and they tend to involve less kind of direction and um, just less content in the actual practice. So if you're willing, I invite you to engage this practice with me in our community here today. Uh, you have a choice in how you would like to engage with this practice. You can either do it with eyes closed, and you may have a mindfulness practice where you're comfortable with closing your eyes, or you can choose to have your eyes open. If you keep your eyes open, what I recommend is you just kind of bring your gaze down in front of you about maybe 1 or 2 feet. So for me, like I have the kind of microphone here in front of me, I would just gaze down at that microphone and maybe pick a spot on the microphone or maybe the desk in front of you or the computer or keyboard that you like to focus on. If not, you can close your eyes. So I invite you to do that now. Either close your eyes or just bring your gaze down. And just allow a couple moments to land right here where we are today, here and now. And there's no direction with land. Wherever you land is completely fine. Just allowing yourself to land in this space and in this time together as a community. And now, once you've landed, I want you to firmly ground yourself in that place. And the way you can ground yourself is by bringing your awareness to something that feels stable. So that can be your feet on the floor. It can be your seat on the chair. It can be your hands on your thighs. Just notice what it feels like to ground yourself. And then moving from that grounded place, I invite you, when you're ready, to guide your attention to a part of your body that feels good, that feels safe, and that feels comfortable. And once you found that place in your body, place your hand over it. And if you can't find anything in your body that feels good or safe or pleasant, then I invite you to bring in an image that feels safe or pleasant, or maybe just a thought that feels safe or pleasant. For me, I find that the sensation of my heart beating feels pleasant, so I just place my hand gently over my heart. And then once you find that place, we're going to stay with it. So I invite you to stay with what feels good, what feels safe, and what feels pleasant. And then I invite you to deepen your focus or your concentration on that place that feels good and safe. And if you find your mind wandering to different thoughts or different sensations, or maybe an emotion arises, just nice and easy, guide yourself back to that place in your body that feels good and feels safe. And take the time now to savor and really enjoy what that place of goodness and pleasantness feels like. It's almost like you can immerse your entire experience in savoring what feels good in your body. And then just make a mental note to yourself that if you ever have something that feels uncomfortable or unpleasant, or maybe painful, either physically or emotionally, that you always have this place to return to, this safe place in your body. It's a place for you to come back to again and again. And then if it feels good for you, take a nice deep breath in and out. And then you can wiggle your fingers and your toes. And then when you're ready, you can slowly open your eyes and come back to the present moment here. Okay, so I wasn't timing, but that was probably a practice of about 5 or 7 minutes. These are common practices that I have used with patients throughout many, many years of pain care. People find them to be pleasant. They, of course, alleviate some of their physical pain as well as their emotional pain, because we know that pain is both a physical and an emotional experience. And I'm going to talk about that as we kind of move on in our webinar here today. So I'm going to share my screen and kind of begin. So obviously today's webinar is on mindfulness-based pain relief. Just some quick learning objectives. We'll talk about the evidence that supports mindfulness. We'll describe kind of the unique cognitive change processes at work in the nervous system. And by the end, you'll be able to identify the components of a mindfulness-based pain relief program. Um, there are references for those of you obviously interested in the science. There are references that are on the bottom of the slides, and I have some references at the end. But if there's one reference I can point you to, it's this paper that I wrote with two of my colleagues that was published in the Journal of the American Physical Therapy Association, PTJ. You can find this freely if you go to ResearchGate and you look up my ResearchGate. Everything that I've published is there freely, so you can just download it and read it on your own time, essentially. When we look at mindfulness, I look at mindfulness as a mental training that we use to improve or shore up one's psychological skills so that they can have either a physical or a mental health benefit. Obviously, our physical health and our mental health are interconnected. Some people, kind of more traditional definition of mindfulness is a state of non-judgmental awareness of one's thoughts, emotions, and physical sensations. And even in that brief practice we did together, we did focus on kind of non-judgmental experience of thoughts, emotions, and physical sensations. With that, we try to train an openness to whatever arises, an attention to the present moment instead of letting our mind wander, and just a curiosity about what we're experiencing both mentally and physically. Our life includes some stress in it, right? When that stress is, we don't have skills to deal with that stress, it can oftentimes lead to what's called distress. So distress are symptoms of things like anxiety and depression, right? Symptoms. When those symptoms become out of control, they can potentially lead to a mental health condition, right? So we see patients obviously start with stress in their life. That stress leads to distress, which may eventually lead to a mental health condition. And we know that our mental health is kind of has this like bi-directional relationship with our physical health. When we start, I just want to kind of take a trauma-informed approach to mindfulness. Um, Trauma is very common in all the populations that we work with as health providers, higher in those who live with chronic pain. So before you start using mindfulness, and I talk about this in lots of other programs that we have, you want to first make sure if you're a licensed health professional, whether that's PT or an OT, physician, chiropractor, any mental health provider, you should be screening for acute signs and symptoms of PTSD. That's really simple and easy to do. It's only it takes a moment or two in a self-report questionnaire. Uh, we go through this both in the trauma-informed care course that we teach here at the Integrative Pain Science Institute, as well as our mental health physical therapy certification. Once you've screened and you know that someone doesn't have acute PTSD, because someone has acute PTSD, that is going to be your trigger to refer to a mental health provider, right? Once we know they don't have acute PTSD, then it's up to you to okay, let's start to establish safety and trust, right? And start to explain how we work with both the mind and the body as physical therapists and other health providers. From there, grounding practices are a good place to start. So if you think back a couple of moments, the first thing I did with you, because I don't know all of you, is I just grounded you, right? I grounded your feet on the floor, or I grounded your kind of bottom to the seat, or I grounded your back to the chair, right? So we ground people first. There is kind of this, there's a lot of information out there nowadays on the internet about breathing. I think mindfulness of the breath is a wonderful exercise. It's not the best approach for people with high levels of anxiety and or symptoms of trauma, so to speak. You may eventually get to that place, but that may not be a good trauma-informed place to start because a lot of people have challenges with focusing on their breath because it leads them to feelings of panic and maybe not being so in control. And then choice and agency, right? So we invite people into practices, right? We ask them, would you like to do this with your eyes open, your eyes closed? We give them choice. And with those different types of choice, and I go through this, further in the program, things like that, people have a sense of agency then, right? So these are really just basic foundational principles of trauma-informed care. But of course, this relates to mindfulness, is really important. When you don't abide by these kind of guidelines, you may risk re-traumatizing someone, right? And that's what we really want to try to avoid in practice. So let's move into a little bit of the science. How does mindfulness work? Well, three core basic mechanisms. One, when you train mindfulness through meditation, it helps people gain a sense of cognitive control. So some type of control over their thoughts. It helps with emotion regulation and it helps with self-awareness. And most of that self-awareness is through interoceptive processing, right? So becoming aware of all the experiences that I feel in my body. Emotions are part of it, but there are other physical sensations that are present as well. You really need to train all of these. You can't just train one. A lot of people come to mindfulness and they think, I'm just going to gain control of how I think. That's good and that's useful, but we also have emotions that arise and we also have other physical sensations that arise. We need this trifecta, right? We have to train this trifecta to work with people effectively. Kind of going a little bit further into more of the cognitive processes, right? So there's an intention that we all create. Intention has an impact on our behavior. Mindfulness helps people stay motivated. Mindfulness helps us decenter or distance from our thoughts. And that's really helpful for a lot of people because they've been struggling with these either negative thoughts or they've been struggling with persistent thoughts of pain. So moving back or decentering or distancing is important. Non-attachment. So I can notice things that arise, but I don't have to be attached to them. It helps with memory reconsolidation. So we can actually change someone's memory of pain, let's say. Emotion regulation and awareness and intention we already spoke about in the previous slide. Why is mindfulness important in pain care? Well, kind of that first bullet there is that we know through functional MRI studies, there are about 44 different parts of the brain that are engaged when pain is happening. So we need an approach that focuses on not one part of the brain, but can focus on many, many different parts of the brain. And again, you hear things in both professional lectures and on the internet, like we need to quiet our amygdala. There's some truth to that, but there are 44 different parts of your brain at work. It's not just your amygdala, right? And the amygdala is not just your harm alarm. There are many parts of your brain that focus on harm and danger. So what's nice about mindfulness is it trains all these different networks, which I'll show you in a couple of moments. When you train different parts of the brain, then you're training both the cognitive and the emotional processes, which are important. And with that, then we have a focus on emotions, behavior, and that's when mood and pain starts to change. So the take-home message is many parts of our brain are involved in pain relief, and mindfulness can start to train those different parts. Now, what are those different parts? On the left-hand side there, we're looking at the default mode network, the salience network, the central executive network, and then finally the affective, the emotional or interoceptive parts of our brain, right? So vast network. It's almost like vast highways in our brain and our nervous system that we're training instead of just one part of our brain. And that's what you want, right? We have this wonderful, incredible organ called the brain, which is attached to our entire nervous system. And we want to train vast networks. Now, when you train those vast networks, what happens is fear starts to decrease, right? It may go away completely. It may just decrease enough that, okay, I now can start to do my physical therapy exercises. Acceptance, right? So we can start to accept that there are different thoughts, physical sensations, and emotions that arise. And oftentimes we don't have control over those, but we do have control over how we respond to them. And that's what mindfulness helps us with. Mindfulness helps us disengage from pain. So instead of focusing on pain, instead of having our attention placed on the pain, it helps us disengage from that. And that's really nice because we get some distance from pain. There are opioid and anti-inflammatory chemicals that are released with mindfulness, and then it strengthens our ability to appraise nociception. So for those of you that are clinicians, you know that nociception is that signal, right? And how we appraise that signal really kind of depends on how we so let me rephrase that. How we appraise nociception, right? The judgment we place on nociception has an impact on how we experience pain. There have been many, many studies, lots of meta-analyses, systematic reviews that show that mindfulness is associated with reductions in pain more than passive treatments, more than education, more than support groups, and more than just treatment as usual. It's associated with significant improvements in both your physical health and your mental health as well. One of the best, I think, examples of mindfulness is they took an 8-week mindfulness-based stress reduction program, and they compared it to 8 sessions of cognitive behavioral therapy for people with chronic low back pain. Cognitive behavioral therapy is oftentimes seen as the gold standard, meaning that you're guaranteed to get a good result from it, or some type of result from it. And what they found was that mindfulness produced significantly greater reductions in pain catastrophizing, or just what we call worry, compared to CBT. The outcomes were maintained at 52 weeks, so there was lasting impact of this training. So just with over the course of about 8 weeks, there was a lasting impact over many years. And then finally, that even though cognitive behavioral therapy tends to focus on helping people control their thoughts, where mindfulness just is helping people notice their thoughts, is that mindfulness actually outperformed the CBT in this particular trial with regard to catastrophic thinking, or just what we call worry. So we know that mindfulness really can hold its own against some really other important approaches that we have for chronic pain. Now, why do people choose mindfulness? They choose it because they've heard that it helps with pain relief, it helps alleviate their anxiety, it helps them sleep better. A lot of people find mindfulness approaches to be very approachable, meaning I don't have to necessarily go to someone's office, let's say, for years of therapy. It alleviates a lot of stigma, so they don't feel like they have a mental health condition, that they feel like they're working on their mental well-being. I love using the word mental well-being. I think that lands better than things like depression or anxiety, right? This type of approach alleviates your pain, helps alleviate anxiety, and it improves your mental well-being. Everyone wants to improve their mental well-being. Now, there are some people that are skeptical, right? There are always people that are skeptical around things. Some people don't like the term mindfulness. They don't like the term meditation. There are lots of other terms that you can use as a provider, things like mental strengthening, things like a mental training, things like mental resilience. All those land well with different types of people. It just depends on who it is that you're working with. Some people don't like to do eyes closed exercises. That's fine. You can use eyes open. We talked about it in the beginning. Some people don't have the time, or they don't want to sit for 20 minutes at a time. You can dose this into 1-minute interventions, 3-minute interventions, 5-minute interventions, things that are small, things that fit well into physical therapy, and things that fit well into people's lifestyle. Speaking of small, let's work something in right now, just a small, brief practice, right? This is called Stop. It's a well-known mindfulness practice. So stop whatever you're doing. So I'm just going to stop talking now. And I'm going to take 2 breaths. After those breaths, I invite you to observe what's happening inside of you. What do you notice happening inside? And what do you notice happening outside? Maybe you notice a sound, or a tree outside, or the light coming in through the window. And then once you've done those 3 simple things of stop, take a breath, observe, now you can proceed. And you can work these things into your own life. You can work these things into your care with people, no matter what type of practice setting that you're in. Mindfulness and physical therapy. So the American Physical Therapy Association released something in 2020 solidifying that it is within our scope of practice as physical therapists that we both screen for and address behavioral and mental health conditions with patients, clients in our population. So a lot of PTs are looking for ways to start to address the mental and behavioral health component, and mindfulness is a really easy way to start to do that, and it is within your scope of practice to do that. Also, mindfulness has been treated in many, many different types of painful conditions that we see in practice. So whether you're seeing clients with fibromyalgia or headaches or osteoarthritis or autoimmune conditions or depression, anxiety, or symptoms of trauma, mindfulness has been studied and has shown efficacy and effectiveness in all of those different types of populations. So it's what we call transdiagnostic, meaning mindfulness can apply to all these different conditions. Going a little bit further, we talked about this in our paper, that mindfulness boosts your immune system. It modulates pain. We already spoke about that. It's being used in sports injury and performance. Many professional athletes use mindfulness to improve their mental strength, right? Athletes are interested in improving their physical strength. They also use it to improve their mental strength. Health and wellness. So mindfulness has been used for things like blood pressure and heart disease, diabetes. And then finally, looking at mental health promotion, prevention, and management, things like anxiety, depression, insomnia, and to support people with a history of trauma or adverse childhood experiences. What's the dose, right? So now we know that mindfulness is medicine, an easy form of medicine that we can all access. What's the dose? Well, starting out, just 5 minutes have demonstrated positive outcomes. And that's why in the beginning, what I did with you, just about a 5, maybe 7 minute exercise. That's really all you need to start people with, 5 or 7 minutes. I recommend if you're a physical therapist, doing it at the beginning of a session, but you can do it in the middle. You could do it at the end to close a session as well. It's really just up to you. It's up to you and your practice environment. And of course, the patient in front of you, right? We always want to provide patient-centered care. So some people may like to do this as a beginning practice. Some people may like to do it to kind of wind the session down. I always recommend working these things in little bits, right? So little pauses always help people as well. What's the effective dose for pain? Let me stick on the first bullet there. So what we know is when people have meditated, this was a study, 20 minutes for 4 days, that they experience a 57% reduction in pain unpleasantness and a 40% reduction in pain intensity. That is very, very significant for just 4 days of an intervention. Longer, 10 hours of practice, right? Now we're looking at people who meditate regularly. Nociception can start to be modulated or change. And then even longer than that, look at people who have meditated for years, like 1,000 hours of practice. They can actually reduce pain and their appraisal of pain almost on command in some way. Pretty cool stuff. So as you move from kind of novice practice all the way to more experienced practice, you can see how people can really modulate their own nociception and pain. Why do practitioners use it? It's safe, it's brief, and it works. That's really kind of the top 3. It's safe to use with patients and clients as long as you have some training. It works. Evidence demonstrates that. And it's pretty easy. It doesn't require equipment. You need if you're in a busy clinic, you need a relatively quiet spot. But I've had, therapists come through my training that have done this even just in the corner of the gym, so to speak. And that's interesting because, we don't always have this opportunity in life to sit on a meditation cushion, right? That's not realistic. We want to work these skills into our normal life. So there are times where maybe doing it in the corner of a gym, once someone has some skill and some, understanding under the belt, might actually make sense. And obviously it complements other therapies really well. I do have a training on this, right? So I do have a certification program in this. It's called Mindfulness-based Pain Relief. It's a 7-week, it used to be a 7-week training, meaning I rolled the information out 1 week at a time. But currently, all of our courses are open, so you can move through that training as fast or as slow as you want. It's about 15 hours worth of training, and it obviously goes over mindfulness for pain relief. In those 7 weeks, so week one, we discuss the neuroscience of mindfulness, so you understand the neurophysiologic mechanisms. Part two is mindful reappraisal, so you learn how to use mindfulness to reappraise thoughts and emotions. Part three, we focus on interoceptive training, so understanding how our bodily sensations integrate with our emotional processing. Part four, we go further into emotion regulation. Part five, we go over compassion focused care, learning how to cultivate positive emotions that oftentimes can be missing in people with chronic pain. And then finally, mindfulness intention. So learning how to use mindfulness as a form of behavior change. And then finally, part seven, things that you would need, right? The trainer proficiency or the practitioner proficiency, things you would need in your practice to help shore up these skills. In the program, there are over 35 different mindful and cognitive-based exercises to use with patients. They're broken down into short exercises between 3 and 5 minutes, medium of about 10 minutes, and longer of about 20 minutes. And with each week, I work you through short, medium, and long. So you kind of know what it feels like in your own body, and you know how to deliver it as well. At the end, if you're interested in creating like group interventions that are like protocols more over 7 weeks, I include information about that as well. We do have a online group for the program. There are transcriptions of all 35 exercises, so you'll have the audio as well as the video transcriptions. In the beginning, you might want to practice with maybe another clinician and have the script in front of you and practice the exercise before you become more comfortable and work with your patient one-on-one. Again, I mentioned at the end, there's a kind of a protocol manual for you to use, basically. I'm going to put the link in the chat thread so you can click through it to that page. Again, this is the curriculum. It's about 7 weeks, but you can go through it at your own pace if you want. But each module, each week or each module is a different topic. There are 35 different mindfulness exercises, and it's just $549, and you do get CEUs for physical therapists and physical therapist assistants. Okay, I'm going to pause for questions. If you raise your hand, I'd love to speak to you, and you can raise your hand or you can type in the chat thread, and I'm happy to answer your question in the chat thread. The program is open now, so you can, of course, purchase it now. You can go through it at your own pace. You do get 15 CEUs for physical therapists. Once you purchase the course is yours for the life of the Institute. So you can come back to it over and over again. You can download, as I mentioned, all the exercises, all the handouts that are there, all the slides, all that's available to you to access and download. And just look and see if you have any questions. I don't see too many questions popping up. If you have a question, you can either type it into the chat thread, or you can raise your hand and I'll come over and unmute you. So there's a question here that says, when do we draw the line between what's within our scope of practice and when should I refer a patient to a psychologist? So as a physical therapist, addressing mental health is within your scope of practice, but you also have a personal scope of practice. So your personal scope of practice is what you are educated and trained in above and beyond, let's say, school. So school gives you a foundational practice, then you have your personal scope. So I always give an example of dry needling. So dry needling is within our scope of practice as a physical therapist. However, I have never taken a dry needling course. So I'm not just going to go purchase needles and start sticking them into people's lower back, right? I'm going to get some training. Well, it's the same with anything. It's the same with mindfulness. It's the same with any approach. You want to make sure you have some training, which is why I developed the course and the certification. Now, we refer people to mental health providers when, one, it's something outside of your training, something you weren't trained on, or someone has severe symptoms of a mental health condition that needs to be appropriately diagnosed. And then at that point, we co-treat, right? So the physical therapist and the mental health provider then co-treats together to help that person overcome whatever it is that they're facing. So hopefully that makes sense to you. But really, two things. It's up to your personal scope, one, what you're trained in. And then two, if someone has an undiagnosed mental health condition that you think they need help with, then refer them to mental health. And you refer, you stay connected. So then you start to co-treat with the mental health provider. And most mental health providers are really excited that you're, as a physical therapist, you're part of the team and that you're using these techniques because what we know is that these techniques and skills, when they're reinforced by multiple providers, it tends to move the person along in their recovery process faster. Francesco, hold on one second. There you go.
Yes. So first of all, nice to meet you, Joe. I'm Francesco. So I have this question. Can you explain a bit better what you mean with be cautious with the breath, with the breathing initially? Because I experienced that, and I think I understand what you referred to, but if you can give me a little bit more information.
Yeah, sure. It's a great question. I think there's a myth out there that breathing is easy for people, that it's something that humans do naturally, that we were born breathing. And that's true. We obviously come into this world, yes, and we start the respiration process. But when you develop things like stress, chronic stress, when you have some people are very highly sensitive to anxiety and things that may trigger anxiety, and there are some people with trauma and trauma histories, and all those things have the potential to disrupt our normal kind of breathing mechanism. And people live like that, right? They live with shallow breathing or they live holding their breath. We see this all the time in physical therapy. So if you come in and with, we're all well intentioned, right? And we think that breathing is easy, and it might be for us with a lot of education and experience. But for a lot of people with anxiety, sensitivity, or panic conditions or trauma, it's actually really difficult. And then you now take their attention, you're focusing them on something that's really difficult to focus on. And that can trigger more feelings of anxiety and, God forbid, a trauma response. So there are things I do with people. So, for example, sometimes I have them just rub their hands together so they get some warmth in their hands. Most people like the sensation of warmth. And then I have them place their hands on their thighs and just focus on that first, right? So, because a lot of ways we're retraining attention. Focus on something that feels good first. If you were with me, Francesco, in the beginning of the webinar here, I had you focus on what felt good in your body first, right? So I grounded you to your feet, and then I grounded you to something that felt good in your body. And our patients are looking for symptom reduction. They're looking for things that feel good. And if you can show them, okay, this is what feels good first, we can always return to this place, right? We have that anchor to return to. Then in the weeks that follow, now we can start to retrain or start to train moving out of what feels good to things that might be a little more challenging. But, there are neurophysiologic changes that happen in the nervous system with breathing. Breathing is a brainstem function. And we know that a lot of the trauma responses actually start in our brainstem and they overlap. So those are some of the things that I think we can talk about as professionals as far as why breathing might not be the best place to start. It might be for some people. You might have success with it. For others, it can be very difficult for people to focus on their breathing. And then, from a purely biomechanical perspective, don't forget when people have poor posture and they haven't used that breathing mechanism, like we're now asking them to take really deep breaths, and they haven't done that, it's difficult. There's tension and restriction there that we might not have to work on manually as well as the mindfulness part of it.
Okay, can I ask you something more
Sure
related
thing.
to this?
Yeah.
Because thank you for the clarification. So I will bring the case report from my patients, so maybe you can help me understand if I did something wrong or not. So it was the first session, and this patient has low back pain, and we were working in a lying position with diaphragmatic breathing, and she started to cry. So, and then she started telling me about a bit more about her story. So I would like to know from your experience, like if this is a sign of having done things a little bit too quickly, or is it normal, or I don't know. From your experience, I would like to have a feedback. Thank you.
Yeah. So the question is you're working with a patient who has chronic low back pain, and you start a basic diaphragmatic breathing exercise with her, like lying down on the table, knees bent, and just maybe hand on the belly and hand on the chest, and you just start breathing. And is this the first session or
Yes, it was the first session. Of course, there was the first part of anamnesis and get to know the patient. And since I assessed that the low back was in this tension activation from the muscles, then I decided, okay, let's try to focus on give it a little bit of release to this tension.
so
Yes.
how did so it, as before I just want to gather some more information so I can help
Yeah.
you a little more effectively. So you I guess performed a physical evaluation of her lower back, right?
Yes.
And then how did you kind of ease into or enter into the idea of the breathing exercise? What kind of education did you provide?
So what I like to use is the analogy of the clenched fist. I don't know if you know.
Yeah.
And then from that, I try to explain that it could have helped getting a little bit of relief in a easy way that she could have performed also alone at home.
Yeah. Great. So then you start this gentle breathing exercise that we think is gentle,
Yeah.
and some emotions arise, right? Yeah. And then how did you respond to her?
Um, that's a good question. So um, I thanked her to open up and that um, it's a safe place. And if she had the feeling that she was losing control, I said to her that we could have stopped as soon as she wanted.
Yeah.
And the possibility was to give it a try a next time with fewer uh, repetitions of the exercises.
Yeah.
Yes.
Great. You've done a lot of good things there, Francesco. Um, so if you think back to the slide in the beginning, where I was talking about kind of a more trauma-informed perspective, um, you had mentioned to her, um, if you don't like this exercise, we could stop at some point, right? Um, one thing you could do is put that in the beginning. Like, I'd like to start with a simple breathing exercise. A lot of people find relief from it. Occasionally, there's someone who might not find relief from it, who don't like breathing first. But you're in control here. So if at any time you want to stop or you want to take a rest, just let me know and we can do that or we can modify it. So that way you give her some control and agency over the exercise. Um, it is interesting that sometimes emotions arise when we don't expect it, right? And I don't know why that happened with her. I'm interested to explore that more. Um, but again, you can kind of front load some of those things and say sometimes you might notice tension arise, right? And with that tension, there might be a difficult emotion. And part of what we're doing here together, you and I, in this process of recovery, is we're just making space and allowing whatever emotion arises to be present, right? And you did. I think you validated her at some point in that process, which I think is really good. Um, some other things to consider is I've had similar experiences with patients, and sometimes people are just thrilled that we're doing something that is relatively basic and feels good, right? And there's an emotional release with, oh my God, someone's giving me something that feels good and that I can actually do. Because so often people wind up in a physical therapy setting and they're intimidated by it. You know, there's gym equipment around, and oftentimes we have people with chronic pain next to athletes, and they're not sure. So oftentimes there's just like this emotional release of, I'm in the right place, right? Um, or I'm with the right therapist too, right? Like, thank God this person's handling me in a gentle way versus a way that the last provider was really rough, right? Um, there's also, and also with that, sometimes when good things arise, there's almost like this pendulation over to, oh, something feels bad, or I realize there's something bad here as well, right? So there's a lot of different things that arise. I think the important thing is that you gave her space to work with it. Um, and that I think exploring that in the next sessions that come up are really important. I don't know where you are with her, but those are things that kind of come to mind essentially.
Thank you.
Yeah, great question, Francesco. Thanks for giving me the opportunity to talk through that. I appreciate it. Anyone else have any questions for me? Yeah, so in the course, we go through many different types of mindfulness exercises. So you'll get a good mix of things you can use because if that person would have said, I don't feel comfortable, I feel uncomfortable doing this breathing exercise, then you can move to mindfulness of emotions or mindfulness of body sensations. Um, there's so many different, like I said, there's 35 different techniques. So there's lots of different choices that you have. And that's what you want in your toolkit. You want choices with people because people are unique, right? This is patient-centered care. Some people do better with mindfulness of the breath. Some people do better with mindful movement. Some people do better with mindful emotions. Some people need just a lot of education in the beginning where they just need to talk and understand what this really means, what this really entails. Anyone else before we start to wrap up here on this Saturday afternoon?
Joe, I have a comment.
Yeah.
So essentially, anything that we do could be mindful. If it's folding clothes or how we're eating, taking our time eating, and really, engaging in the process of. And recently, what I ended up doing, like usually when I lift weights or work out, I'm always got a lot of music on, to motivate me. So just the other day, I decided I'm going to do a mindful workout. No music, no noise, just kind of getting in tune with my body and actually feeling what it's like to lift the weights, hear the noise, feel the sensations in my body. Maybe sometimes, your brain overpowers and says, oh, you can work through that. Really listening to my body. So I took that normal workout I would be doing and made it into more of a mindful
Hmm.
experience. I don't know if I could do it all the time like that because I really like to have the music, but it was a really interesting experience, something that I'll do occasionally just to check in with myself. Um, but essentially, it's like, okay, I can basically do any kind of activity with that concept of mindfulness. Would
Yeah.
that
Yeah, I love that, Roger. And I think that's really important for us as physical therapists. And in your description there, where you're really describing is when I'm exercising, I can have an open awareness, right? So I'm exercising, I can be aware of the person on the treadmill next to me, um, the temperature in the room, sounds in the room, right? That's more open awareness. Or I can have a more focused attention on, okay, I'm running. What am I experiencing in my body, right? Do I feel my muscles contracting? Do I feel sweat building? Do I feel my blood pressure or my pulse, thumping, so to speak? And when I exercise personally, I move back and forth between all of those. And I'm training or you have the ability to train all those different networks in the nervous system when you do that. And we can bring that into PT practice really easily, right? So what does it feel like when you're doing this stretching exercise? What do you notice in your hamstring? Describe it. How does that feel different from your other side, right? So what I like what you're talking about is taking the principles and bringing it to our daily life.
Yeah.
For most of us on the call, our daily life is treating patients. That's a big part of our daily life. But there are ways that we can then, um, kind of empower our patients to take those techniques and bring it into the rest of their life.
Thank you.
Thank you. Okay, I don't see any further questions. We're just about at an hour, which is good timing. I know it's a Saturday, and all of you want to get back to your friends, family, and loved ones. I'd love to have you join our community and join the mindfulness-based pain relief certification. It's one of the more popular courses that I have. People love it. It's really clinically useful. There's tons of things in there that you can take to your clinic starting on Monday. And if you like the science is in there too. If you have any questions, you can reach out to me or our team, support@integrativepainscienceinstitute.com. That's support@integrativepainscienceinstitute.com. All right, I appreciate all you being here, and I'll see you soon. Take care. Ciao.